Milk Fever by
Becky Vinton
Krista Osdick
and Jordan Matties.
This is what milk fever looks like. Milk fever, also known as parturient paresis, causes hypocalcemia, which means there's not enough calcium in the blood or the body. It is not caused by bacteria or viruses, but from a lack of proper nutrition. So be sure to drink your milk, kids. Milk fever happens in all types of animals, but we mostly see it in older dairy cows at parturition, or when they are giving birth. There are 3 stages in milk fever. Stage 1 has widespread muscle tremors, smooth muscle paralysis, which means muscles in the cow's stomach and throat don't work properly, so the cow can't eat. The cow can't urinate, and the cow may fall down and not get up, just like in the video. In stage 2, the cow's temperature will lower, just like when you get a cold, and you may need extra blankets because you feel chilly. The cow may also get a dry muzzle. Stage 3, which is the most severe stage, is when respiratory rate decreases, the heart rate increases, but the heart itself becomes weaker, and the cow's pupils become more dilated. At this stage, it's very, very important for the cow to get some help, otherwise it could possibly die. Milk fever affects many systems in the body. We will start with the skeletal system. In the skeletal system, compact bone, or the outer bone layer, as you can see in the slide, is affected by milk fever when calcium is taken from it to be used in the body. Older dairy cows are affected the worst by this, since their bones are older and have used a lot more calcium. And even when calcium is taken from the bones, the body still cannot get enough of it. Now we'll look at the muscles. There are 3 types of muscles. Smooth muscle, which is found in your stomach and intestines. Skeletal muscle, the muscles you use to run and play, especially when you're at recess. And cardiac muscle, which is the muscle in your heart. Smooth muscle, which is muscle in your stomach, is affected by milk fever because the muscle cannot work properly, so the cow cannot eat and it loses energy. Cardiac muscle, which is the heart, is affected because the heart begins to beat faster to supply the body with enough oxygen, but as it pumps faster, the heart becomes weaker. In skeletal muscle, there are signals in your body that tell the outer layer of your muscle to release calcium ions, which causes filaments, or string-type structures in the muscles, as you see in the picture, to contract and make the cow's whole muscle move. Now, the immune system is also affected. This system is what keeps you from getting sick. When it's affected by milk fever, body temperature is lowered, the cow has a dry muzzle, and it can get cold legs. It also lowers white blood cell count, specifically T cells. And white blood cells are the cells in your body that fight off bacteria and viruses to keep you from getting sick. So when there is not enough of these in the cow's system, it can also get sick very easily. Finally, the endocrine system is a system that controls hormones in the body. And hormones are chemicals in the body that tell specific organs to perform specific tasks. The parathyroid is the main hormone affected and comes from the thyroid. When milk fever affects this hormone, which causes calcium to release from the bone, this calcium is absorbed by the kidney and is not released to the rest of the body, so the rest of your body does not get enough calcium. As you can see, milk fever affects the cow's whole body and does not allow it to maintain homeostasis. Homeostasis is the ability of a body to keep all internal systems at a normal value, which keep the cow healthy. And you also have homeostasis, so that's what keeps you healthy too. Milk fever is usually very easy to treat and is treated with calcium supplements such as Calciject. Soon after this treatment is given to the cow, they're usually fine, as you will see in the video. Moral of the story, make sure you get enough calcium.